Good afternoon. Welcome to the sixth Tipping the Pain Scale movie event and panel discussion. We are here in Wilmington at the lovely UNC Wilmington campus. I'm delighted to welcome you with us today. I hope you got a chance to watch the movie in advance to help set a context for the conversation. If you did not, though, don't worry. You can watch it through tonight. You can watch it tomorrow. So that link is still active for you. You can watch it in the comfort of your pajamas tonight if you didn't get to watch it in advance. Before we get started, I want to thank our partners throughout this series. We partnered with the UNC Systems office, as well as the North Carolina Independent Colleges and Universities and the North Carolina Harm Reduction Coalition to pull off this drive around the state, really having community conversations about what we're experiencing and what that looks like in each area. So thank you to our friends and panelists for being here with us. Before we get started and introduce everyone, you may be familiar with Greg Williams, who produced the movie, and most of us in the field know him quite well. We'll talk with him about his prior work and where he's at now and where he's going in a moment. But for APNC, Addiction Professionals of North Carolina, it was important for us to host these conversations for a lot of reasons, and to host these right now specifically. We're coming out of really a dual pandemic, or we're right in the middle of it still. We are coming off the opioid crisis. We were just talking about that before the panel started. We already were strained before the pandemic started. Where we're at now with the rises in need for help, need for services, the strain on families, the strain on our human service system and our behavioral health system, we thought that right now is a really important time to be having these exact difficult, enlightening, open, honest conversations, and to really highlight where we're all at, where we sit, where we want to go forward, and how these issues are experienced in each area. So for APNC, now is the right time to have these conversations. I think our harm reduction friends, so that North Carolina Harm Reduction Coalition is a partner with us on the series. I think harm reduction is now finally gaining some of the traction that it has been trying to gain. And so we want to stand together with those friends, and also it's an important time to be highlighting that good work and to talk about why that's an important part of the continuum. So that was another reason APNC wanted to do this now. And then our leaders, our legislators, our elected officials, our state leaders have been really head down, just grappling with the challenges that they have, all the changes in the landscape and dealing with the pandemic protocols and how should we best fund, what's the best answer and what's needed. And so I think in that work, they've been less able to sit with us all in the ways that they used to. And so we wanted to host these conversations so that we could put together a picture of every community that we're working with in every area of the state to create what does this look like in North Carolina, and then to give that kind of specific feedback to our state leaders and our legislators about what are we hearing from different areas of the state as priorities. So you will get in your link for the registration, there was a survey. So I'll say this again before we get off, but please do fill out that survey, because that's what we're compiling to take when we go and say, okay, here are the priorities that we're seeing in this area, or here's what we heard quite clearly in these conversations. That'll be some of the ways that we do that. So let us hear from you what those priority areas are so that we can advocate on your behalf. So that's why we decided to do this series right now. And that's the purpose that we're anchoring this in, is being able to really show what's working in areas and what's still needed, and to be able to communicate and advocate with our leaders in that space. So let's go ahead and get started with introducing the panel. I know everyone has seen their bios in the slideshow, so If we can go around the table, please start with Margaret and have you introduce yourself, tell us where you're from and why it's important for you to be here.
Thank you. I'm Margaret Wallace-Stargell. I'm President and CEO of Coastal Horizons. We are an organization that's been around for 51 years, and we provide a number of behavioral health and primary care services. And it's important for me to be here to be part of the conversation and discussion around opioid use dependence.
Okay, thank you.
Hey, my name is Karen Garcia. I am an MSW student, Master of Social Work student here at the University of North Carolina, Wilmington. I support running the collegiate recovery community here on campus. And I'm also in long-term recovery. So this is especially important to me because this is this conversation because it's my daily life.
Hi, my name is Mitch Cunningham, former Deputy Chief of the Wilmington Police Department. Currently, I'm a member of the advisory group for the quick response team here in the Wilmington, New Hanover County region.
Thank you for being with us. Greg?
Greg Williams. I am here as the producer of Tipping the Pain Scale, but also a person in long-term recovery and, passionate about the systems change work that APNC is working on. So thanks for having me.
I'm Johnnie Puckett. I'm the president of Peer Recovery Resources. That's a nonprofit. We train peers to become peer support specialists. And what a peer support specialist does, they help people in recovery, whether it's from substance use disorder or mental health diagnosis. And the peer support specialist helps them in the recovery journey because they have a lived experience. I'm also a triple dipper, substance abuse, alcohol, and I'm living with 2 mental health diagnoses.
Thank you for being here. Margaret?
My name is Margaret Bordeaux. I'm an overdose prevention specialist. I work for the North Carolina Department of Health and Human Services Division of Public Health, but I'm a native of Wilmington.
Okay, thank you. So if we can go ahead and get kicked off today, I'm interested to start with you, Greg, if you're open to it. I think the trajectory of the first film, The Anonymous People, through this film now, so I've watched all of the films, I'm curious what you would say about the differences in what we were dealing with and what the intention is of the first film, The Anonymous People, kind of through where we're at now, and any thoughts you have on that trajectory.
Yeah, it's well, thank you, Sarah, and thank you to APNC and everybody for sharing this project as an independent filmmaker. It takes a village to get these projects out there, and North Carolina has been a close friend to many of Jeff Riley, who's the director, and my self in getting some of these film projects out. I think the journey to Anonymous People really was around exploring, kind of the lack of the voice, the lack of, where was people in recovery, where were families, where were people impacted on these issues back in 2013, 2014, and kind of looking at, why do we have the systems that we have? What is holding some of that back? And, and then Jeff and I became very interested after the groundswell of support around the Anonymous People and people who really appreciated that project from a solution perspective of looking at, there's tons of documentaries out there about the addiction problem. There's tons of documentaries about the drug war. There's tons of documentaries out there about all the inequities that exist, but so many of them just leave you empty and hopeless and sort of don't have any kind of sense of like, is there anything we can do? And I think so much of the work that we need to do is instill hope in people who do this work, but also, communities in general, that there are many things that we can do. Not one thing to solve it all, but there are many things that we can do. And one thing is youth recovery supports, and North Carolina has been a leader in that work, and the college recovery work has been inspiring. And so Generation Found really was a film that we came out with in 2016 that helped kind of shine a light on youth recovery supports on high schools and colleges. And we focused in on Texas. Texas has a really unique system, and specifically in Houston and Austin, around youth recovery support and an ecosystem that they developed. And so that was a really kind of fun, localized project where Anonymous people kind of took a national lens. And then, you know, Jeff and I had an appetite to tackle a bigger, you know, another national project. And so Tipping the Pain Scale really, it started pre-pandemic, and what we really wanted to capture is, you know, a lot's changed kind of from our poison drug supply. You know, the opioid crisis obviously, you know, started really in earnest in the 2000s, and it's evolved, you know, through heroin to now over the last few years, it's all fentanyl and all, you know, just this really poison drug supply that's really creating really painful dynamics in a lot of communities. But there's a lot of leadership surfacing in places that, you know, perhaps we've never seen before. And so it was really important for us to want to find characters and find people who are tackling this issue at different levels of society, different sectors. And so we have policymakers and athletes and community outreach workers and police officers. And so it was really a fun project to kind of be involved in and fit the pieces together. And I think Jeff did a really incredible job in terms of not only access to remarkable individuals, but also how to weave them together in a cohesive narrative that really provides, I think, a mosaic of opportunities that communities can choose, you know, in terms of solving these issues at different levels.
Mm-hmm. I agree. So I loved so many things about the movie, so much so that I thought it was important for every community to have an opportunity to see it, and for us as leaders, to local leaders and statewide leaders, to have specific targeted discussions for a follow-up purpose as a consequence. So I'd like to shift a little bit to just talking about the takeaways of the film. What stood out for you? What are you gonna remember later as the high points? We saw so many inspiring stories that ended with some change happening, which I thought was fabulous. Of course, I like the policy arena part of this work. I liked that you could see how people can engage in public policy, how you can raise up leaders that are going to advocate for the field that we're working in, how you can get change as a consequence of that. So I liked that policy connection. But I also really liked the framing of it as we really need to think about this entirely differently. We need to, I don't know the quote, but it was essentially, this is a human issue. We need to really refocus this and change the paradigm of how we're thinking about it in so many ways. And so that really stood out to me as a really important statement in the movie. So that stood out to me. What other impressions stood out for you guys, or key takeaways, or important stories?
You know, one thing that stood out for me, and it was the football player just talking about, you know, his experience. And he said he went to his parents and it was when, you know, it was disclosed about his use disorder, and his family at that time shared with him that it's a family history of use disorder. He didn't know about that prior to like having his own experiences. And so that really spoke to me that we need to start having these conversations, being really honest with youth and with adolescents. And sometimes it's uncomfortable. There are a lot of things that I wish I'd never have to share with my children, but it may be in their best interest to know. And so that really stuck out for me.
Mm-hmm. Yeah, thank you for that.
I think my biggest takeaway was just humanizing the experiences that people go through who struggle with addiction. There was a part in the film that it says somebody said, this person cares about me so I can care about myself. And that was really powerful to have this lens of compassion towards the experiences. The symptom of the problem is the addiction, as Jerome Adams said in the film. And so like just the need to get it right. Otherwise, I think he mentioned like, otherwise we're just playing whack-a-mole with the problem. And so kind of seeing that through a lens, a compassionate lens is really powerful.
I would like to start by saying first, Greg, that I thought the film was so incredibly well done. I hope that many people will get to see it. There's so much of it that resonated with me, particularly with what we do at Coastal Horizons, because from outreach to treatment to all components that were covered in that film, I see that at Coastal Horizons and what our staff do every day in trying to meet the needs of those we serve. What struck me in the beginning when I saw the emojis that, physicians are saying, where's your pain level? And that we began to see more people identifying with having an opioid dependence because of that, as a result of that. And we've all heard about that now with opioid settlements. But I think it's important to say that while we saw that spike at a period of time recently, opioid use has been around for quite a while. We've been treating it since the early 90s. It's been around for a long time. It hasn't gotten the attention until recently because it's a different demographic. When it was early on, just a certain population of individuals dealing with it didn't get the attention that it's getting now.
Mm-hmm. Yeah, certainly true. And with attention also comes data and collecting information that we didn't have before, and then comes more attention on the issue and more funding and more services and more opportunities for help. So yeah, thank you for mentioning that for sure. We had at the last screening, Roz was here, and usually when I ask this question, it's two stories really stand out. Roz, who is on the ground, harm reduction, doing reversals, and she had done hundreds of reversals. What I think we felt from her when she was with us was really palatable. Sitting next to her was the sadness over the reversals that didn't work. And so, she had done hundreds and hundreds of reversals. And then there are a lot that she was not able to save. And so I think that's hard stuff for us to carry with us. If I can switch to, while we're with you, Margaret, I want to hear a little bit about what resonated with you specifically that parallel to the area here that we're in right now. So we're in the Wilmington area. What resonated with you as parallels or things that are promising that are happening here, or things that we really need more of in this area?
Well, again, there were so many components to the film that resonated with me because of what we do at Coastal Horizons. But as I was watching it and thinking about, okay, what is my takeaway from this? What do I learn from this and take back to what we're doing here in Wilmington and with Coastal Horizons and other partners? And I think it's to be more intentional in speaking about the need for there to be an array of treatment options, and to be very clear about the fact that there is not a one-size-fits-all model, and that there are individuals that will be able to recover with being totally abstinent. And then there are individuals that will not recover or be successful in recovery without medication-assisted treatment. Again, we've been providing that for a number of years. And methadone has been around for 60 plus years, buprenorphine more in the past 22 years. And I think it has some difficulty for people because it looks like you're trading one drug for another.
Mm-hmm.
And for some individuals, they're going to say, that won't work for me. I have to be completely clean and free from any substance in order to be in true recovery. But for someone else, when they're able to get buprenorphine, when they're able to get to seeing there being some functioning for them back in some sense of normalcy, that's what's going to keep them in recovery, and that they are in recovery. Those individuals who are getting medication-assisted treatment. I look at it similar to someone who is struggling with diabetes. Some individuals will be able to change their diet, change the way that they do some things, and never have to be on insulin. And then you have others who will not live without insulin. And I think medication-assisted treatment is one of those. And that's not something that Coastal Horizons has decided, or a few of us have come to conclude. There's national support behind it. There's state support behind it. It's an evidence-based practice that shows that people can recover and do well. Medication-assisted treatment is there for them. So again, when I say being intentional in saying that must be a part of the array of services that you provide for dealing with those who are dealing with opioid use dependence.
Mm-hmm. Yeah.
It must be a part of the model.
Mm-hmm. Absolutely. Great. So while we're talking about the Wilmington area and what's working well here, what's promising, I know we have a range of perspectives, which is what I love on these panels and in these conversations. So can I ask the same question of you, Johnnie?
What was the question again?
So the question is, when we're thinking about the Wilmington area and we're thinking about what the film showed us, with the power that you can have in a community, what's working well from your vantage point in this area specifically? So from the peer space, what's working well?
What's working well? Well, for one thing, peer support specialists are becoming more available to the providers in the community to go walk alongside a person that's in a recovery journey. And fortunately, the wages for a peer support specialist has started to climb some, because at one time when I first started working in mental health about 10, 11 years ago, I mean, you could go and work at McDonald's and make more than what a peer support specialist was making. So that's one good thing that I see. And peer support specialists that we train, they're good. They're really good as far as helping a person. They don't tell them what to do. They provide the resources for the person in their recovery journey to help them.
Mm-hmm. Yeah. Yeah, I think it's easier, I would imagine, for a peer to have a conversation with someone who's in a really hard time. I think those conversations might yield different content than dealing with a licensed person straight out of the gate, or at least not having that person who's been there through it with you and can understand it. I can see how that would be really important. Same thing for law enforcement, Mitch. We've talked about this as well. So law enforcement is a really important piece in addiction and helping the community be healthy. I think when a law enforcement person comes in, first of all, they're not a social worker like we are. And so I think automatically when you come in as a law enforcement person, there's there's a lot that goes with that. And so I'm interested to hear what has happened in Wilmington, what is happening to really help law enforcement be a partner and a part of helping fix or make this problem better here.
Sure. Well, I would say one misconception I think some people have about law enforcement is that we are mostly doing law enforcement. And in fact, historically, that's really just a small piece of what we do. So we're on a daily basis, we're going to family disputes, and we're dealing with a lot of law enforcement types of issues. So in many respects, the officers do have an ability to interact with people in crisis in a variety of settings, which may be a mental health issue, maybe some kind of substance abuse incident that they're called to respond to. So a couple years back, Mayor Sappho here in Wilmington convened a roundtable, and what he did is he really set in motion a series of partnerships that we really have leveraged to implement a lot of things to address this crisis. So one of the partnerships the Wilmington Police Department and New Hanover County Sheriff's Office has is with Coastal Horizons. And we offer a LEAD program, which is a pre-arrest diversion program, right? So law enforcement is realizing that many of these incidents we're dealing with really belong better as a public health response than it does as a law enforcement response. So for folks who have small amounts of these types of substances, we're saying, let's get them into recovery. So we literally have police officers who are either taking folks to Coastal Horizons or activating a Coastal Horizon behavioral response. So those partnerships are now, year 3, year 4, they're mature. We learn to trust each other. We work extremely well. And that's just one, actually, frankly, of a number of police, public health, hospital, EMS, nonprofits. For example, police departments around the state work very closely with Harm Reduction Coalition. So as bad as this crisis is, a lot of effective partnerships have been spawned to address it.
Yeah. Any other examples of things that maybe Asheville or Boone or some other area of the state might not be thinking of that we can share happening here that might click a light bulb on?
Well, I would say that the Attorney General really put together a task force on opioids with law enforcement and a number of the state agency representatives. So a lot of things are actually being done around the state. But for example, here in Wilmington, which is also done in Gilbert County, is we have a quick response team. And what that looks like is we have folks, again, Coastal Horizons, one of our best partners, who are within 72 hours or so of an opioid overdose are engaging with that person when they're hopefully in a little better condition to be open to help and open to services. And we know that is not necessarily going to turn around that problem immediately, but that's a relationship. And they're going to check in on that person. And now they're on our radar. And we are starting, hopefully, a process to expedite recovery. But we know that recovery process looks like this, and we've got to be in it for the long haul.
Yeah, that is a wonderful perspective to hear. I think at one point, 20 years ago, that level of understanding maybe you wouldn't normally hear from law enforcement. Really, that what you just said, recovery is a pathway. We have to be in it for the long haul. So to me, just that shift in understanding of addiction and recovery is huge. That's huge. That doesn't happen overnight. So thank you for sharing that. Can we talk a little bit about UNCW? Karen, I feel like I'm leaving you out. I wanna highlight the work that is happening on campus here at UNCW, the work that you are doing, of course, the collegiate recovery program here. So can you talk a little bit about UNCW and how it is meeting the needs of students in crisis or struggling with addiction or helping them stay in recovery during a really hard time?
Yeah, certainly. So UNCW is very, very lucky to have a Vice Chancellor of Student Affairs, Dr. Davis, who feels very passionate about recovery. So in November, I was actually invited to speak at the to the entire Office of Student Affairs, which was about 150 people, all staff of the UNCW, some medical professionals, on just how UNCW or how students have really tendencies towards any sort of substance use may have changed amid the pandemic, and then how to appropriately use recovery first language and support a student who might be in a crisis. And so with that, it's opened up a conversation for me to collaborate with several people on and off campus. We have a direct services coordinator who is she's a licensed clinician. She's one of my supervisors, and she is a great starting point for referrals and resources within the community. And then we also run on-campus recovery program, on and off-campus recovery programming that's really tailored to students' needs and interests at that time. So we host mutual aid meetings. Honestly, what it comes down to is just opening up the conversation and a relationship for the students who are identified to be in recovery here at the university, or are looking to refrain from any addictive tendencies. Whether that be abstinence or not, we just kind of open up that conversation with them and provide them support in a tailored way to how they feel they need to be supported.
Mm-hmm. That's wonderful that you're doing that teach back and that broader education around what's available, what's needed, what this looks like, what it means. That is really important work. So thank you for sharing that. I think when you're working within a university, it's its own system. When you're, dealing with law enforcement, it's its own system. When we talk about state level services, that's their own system. So I'd like to ask Margaret to talk just a little bit about what the experience is like working in systems like that, as well as what people can do to help our systems be more responsive, to help get the wheels to turn, how people on the ground can interact with public systems for the better, which is, I think, what we all really need to be doing right now, which is hard because we're all working really hard. So within light of that, what do you think about interacting with public systems?
Yeah, no, I think that's a really great question, simply because a lot of times I think, even for myself, before I was a part of bureaucracy, people really don't see their roles inside of systems and how it really works, right? So when we say public health, it really means the responsibility of all of us, right? So health is, my health is concerning to my community for many different reasons, especially when we're talking about one of the characteristics of the current opioid crisis, and it's around injection drug use, right? So we have syringe service programs that can respond to a resource need, right? Folks need clean and sterile syringes, and so syringe exchange programs can provide that service. And I know a lot of time, as somebody who worked really closely with this work in North Carolina when it was new, a lot of community members hear this. They don't have a lot of education around syringe exchange programs. They don't have a lot of education around the utility of those programs and how it's really just a benefit to the entire community. So we make judgments and we make overgeneralizations, and we kind of have some stances about things because we just don't understand what the impact could have on like so many other people, right? I know some obvious things that we think about with syringe disposal. They won't be in places where folks can get a hold of them, where, we think about children and parks. That's very dramatic. I try to stay away from examples like that because I really just want to keep people engaged, but I don't want to scare folks off with like those really firm examples and using children. But that's just one way to get folks' attention. The way that I think about it is we want to minimize like transmission acquisition among people who use drugs as well. They may not be children, but they could be somebody's child, right? Or they could be somebody's parent, you know, all community members, all having value. And so if we look at how, you know, my access to health services can someday impact your access to health services, I think that we all understand as community members, we can show up for each other. You know, you can be supportive by also not making those, having those ways that you think about things, right? And having those prejudices and having that stigma. Anti-stigma is a great way to show up for community members, right? So there are people who do need to access those services. And so we want to make sure that they can do that no matter how we feel about these things. A lot of things are feelings. Another thing that I've always asked folks to do is to think about being trained on how to recognize and respond in the event of an overdose. Overdoses are happening at very high rates. You don't know when you may come across one. In my own personal experience, I was visiting my mother's house. I witnessed the overdose happening in the parking lot. I did something that I did every day, right? Go visit my mother. This was a very common thing, but something extraordinary happened one day. An overdose was happening in the parking lot. And it was really raised my awareness. My life has been different ever since that day. And one of the things I felt that I could call 911, I could explain what was going on, but I lacked naloxone, and that's something that I wish that I had in that moment. So I always want everyone to think about that as a tool of empowerment and how you can just respond as a community member. I think we all can just, and I think about this all the time. You know, the quote is, if you can't help people, don't harm them. And so that's a very basic way to look at how the public can show up for folks with use disorder.
No, thank you. What I hope is going to happen, what I hope we're going to learn and practice throughout this period of time, which is unlike any other that we've been in. The need for services, the incredible strain on the system, the opioid use issues, the rise in mental health crises, the increase in federal support that we have coming into the state to help. You mentioned the settlement amounts of money already. So the field has never been resourced properly. We're better resourced now than we ever have been. And yet at the same time, we're trying to figure out what's the way sort of in a better direction right now. And so I appreciate your comments about the systems, because I guess if there's one wish that I have, it's that people are engaged with our systems in a way that is shaping them right now for the better later. So that 2 years from now, we haven't just done a lot of the same things, that we have helped craft, you know, what those public systems look like on behalf of our community. So hopefully that's where we get to. I know, Greg, you have, I know you share that sentiment about the kind of, it's easier to keep doing the same things than it is to figure out what do we do now and how do we get ourselves into a new public system space.
Yeah, I think, you know, we built a lot of our existing addiction treatment or addiction response in the 60s and 70s. And we funded it primarily through government grants and government resources, different than the mental health system and different than most healthcare services, where the majority of healthcare services in this country are funded through the private sector and Medicare. For addiction, it's exact opposite, where we funded this through kind of alternative systems. And, you know, as a result of those fragmented funding streams, we have a lot of residual artifacts that don't make a whole lot of sense in terms of the science and what we know about this being a chronic illness. And so if this is a chronic illness, like many cancers, like heart disease, like diabetes, and we really want to, you know, talk that talk and approach it from a very holistic perspective, where not everybody recovers the same way, not everybody needs the same medication, not everybody needs the same prevention, intervention, all of those things, public safety, all of those aspects, and we really want to individualize our responses, it's going to require us to start to think about this like a chronic illness. And part of that is transitioning the financing to some more sustainable resources so that we're not relying on, is Congress going to fund this grant next year? Is Big Pharma going to bail us out with a settlement that we've been waiting on for 6 years? Or, whatever the case is, or whatever the next resource dollars are, we need to use those new resources coming in to kind of build sustainable systems. And so one of the really helpful things that has happened for this population, obviously, is in many states, not here just yet, but Medicaid expansion has helped, and certainly access to substance use disorder on the exchange plans and stuff. So now regular health insurance, for the first time in this past decade, was the first time that stuff got covered by health insurance. But the problem is they're still buying it as if I was having knee surgery or I was having a baby, where it's like, this finite episode. You go to, the detox, or you go to the residential program, or you go to the outpatient program, and the insurance reimburses for that service in isolation. But there's no, attachment to value or wellness or outcomes, or integration with primary care and all these other elements. So I think it really is like the next decade, we really need to think about how do we braid these housing dollars and the social support dollars with the healthcare dollars, the grant dollars. How do we, braid that in a way that we can respond to people holistically, and then stay with people, not, you don't just go to, the inpatient service and not have peer support. You don't just go to, the outpatient program and be put on medication, but not follow up if you want to stop the medication at a certain point, So we need to figure out ways to meet people where they're at and do wellness. So I spent a lot of time thinking about that stuff, but hopefully it all starts with, the willingness and, the political willingness to impact those systems. So we need people to be voicing this stuff.
Yeah, thank you. I'd like to,
if I may just add to him talking about the political willingness, and I don't want to get too much into that, but I think it's important when we talk about those that we're serving, and there are those that have insurance, but there are so many that don't have insurance or they're underinsured. And in North Carolina, I hope that we're at a place, politics aside, that we're beginning to really look at the need to have Medicaid expansion in this state. We're only one of 11 or 12 now that don't have it. And we really need to have it so that we can get coverage for those who are uninsured or underinsured right now. And if you talk about the substance use disorder client, at least with those that we serve, only 22% right now are Medicaid eligible. So they have no coverage. We need Medicaid expansion.
Yeah. I'll add to that by saying, fortunately in North Carolina, we have a policy where if you don't have a payer, we'll find a payer, right? In our public systems, if you don't have a way to pay, if you're indigent, we will find a way to get that paid for. And usually that is relying on our public dollars in other spaces. So what that means is our MCOs and then our providers end up in that circumstance, Margaret, where only 22% have access to Medicaid and then the rest don't. That tab gets picked up by other grant dollars that can be used to fund the infrastructure, the workforce, those broader support services as well. And so, and I'll add that it's a different reason for saying, but we're paying for folks in one way or another. It's just which bucket is it coming out of? And in many cases, that is coming out of block grant funds that end up paying for services or other grants that could be used for other sources. So,
But when those funds are no longer available,
Yeah.
then it isn't covered.
True. Yeah. Yes. And that's what we're seeing right now. So you were talking about, if I could invite you to share the increased demand for services. You were talking about that before we started. What are you seeing here in terms of increased caseloads, folks waiting to get help?
Well, I mean, I certainly think, as we were talking earlier about before the pandemic, and I think Mitch was saying how we were seeing there appeared to be some leveling of how we were addressing and treating opioid dependence, and then the pandemic. And that has affected everyone in some way or another, whether it's with substance use issues, mental health issues, just anxiety, stress. All of us have been impacted by this pandemic in one way or another. And what I was saying earlier was that prior to that, I believe the numbers that we saw being treated for opioid use dependence was around 400. We have over 600 patients now. And that has grown since the pandemic. The need for services, again, both in behavioral health and primary care, has increased tremendously since the pandemic, and the resources are still limited.
Right. I think what I heard before was this, like, wanting a single bullet. We talked about an episode that you're paying for that you can quantify. I'd like to ask Johnnie to talk a little bit for people who are not as familiar with this work as we are, what recovery really looks like long-term, and what people need to stay in recovery long-term, recognizing that it's not, okay, you're in recovery, check, we're done.
Well, one thing, I think there's a misconception that, okay, recovery is a destination. It's not. It's a journey. It is a lifelong journey for those of us that are in battling addiction or a mental health diagnosis. And that's something we have to deal with every single day. And one of the primary things that we try to help a person with that's in recovery is establishing a strong support network, whether it be family, whether it be a 12-step program, and especially having a peer support specialist walking alongside them through a provider. Because the providers, they're the ones that employ the peer support specialist, then they assign the peer support specialist to the person that's in recovery. And that peer support specialist is going to help provide resources to that person.
They work together.
Yes, exactly.
Support and the providers working together.
Yeah,
exactly.
And I want to mention something, and you were saying it before, just looking at some of those non-medical drivers of health, right? Some of those social determinants of health, I think it's always important to consider those things when we're talking about wellness. And so a lot of folks, like you said, recovery is a journey. You got to think of all the other ways that they're supported: housing, employment, transportation. Yes. All of those things are very critical. And a lot of times with, if you would look at use disorder as a chronic disease, right? A lot of things, your health outcomes are based on your health behaviors. You're empowered to make better decisions and better health behaviors when you have all of the resources you need, when you have access to food and to housing, and to all of those things that can be barriers to treatment. And so a great way to keep people engaged is, again, like you said, to treat that whole person and make sure that folks have all of the things that they need to support them in their recovery.
Yeah. Yes. And if we could do that, we would solve all the world's problems. Yeah. So we have just a couple more minutes before we're going to switch over to audience questions. I know Margaret needs to step out for another event that she has to do. For the question, this Margaret, yes. So she'll be stepping away in a moment for those of you who are watching. Don't take it personally. She's going to speak somewhere else. If you have a question specifically for her, please let us know and we'll make sure that those get followed up on after the event. So I don't want you to miss your opportunity to hear from her if you had a specific question for her. Before we switch over to questions, I personally want to know the answer to this question, and I know, Mitch, you can help me with it. So for a new law enforcement officer coming in, how do they get first exposure to these kinds of things? Or is there training in the academy? What does that look like? And I just don't know.
No, sure. So we do a 4-month training program here in North Carolina. Every state's different, but it's roughly around 4 months. So you think of a new officer, they're going through this 4-month program, and we give them a fire hose of experiences and information, some of which will include how to deal with folks in crisis, whatever that crisis will be. Following that, they go into a field training period. Now, some agencies will also have what they call a post BLET program. So BLET is run by regions here in North Carolina. Could be at a community college. Some of the larger agencies run their own academy. After that, the individual agency says, I want to train you for a period of time on things you didn't get in the BLET program here in our region, things that are specific to our region, specific to our agency. Then they go to a field training program. So they're with an experienced officer who's exposing them to a variety of experiences and actually grading them on how they perform. So some people do not successfully make it through the field training process. And then finally, we have annual training. So the state will define the types of training that they want every police officer, every sheriff's deputy to be exposed to. And then the individual agency on this annual basis will also input different training topics that they feel are important. So, you know, and it's so funny because we're having this conversation about 5 hours ago. I was with some colleagues of Margaret. We were having a lead program, and the question on the table was, how do we get more harm reduction training into Wilmington Police Department and New Hanover County Sheriff's Department? So these are the conversations that are underway to address this enormous problem.
Yeah.
Are they still doing the CIT training?
Oh yeah, absolutely.
CIT is crisis intervention.
Yeah, terrific training.
Yeah. Thank you for sharing that. I think sometimes it's where you sit and what you're seeing every day, and that's what you think is true, and you just maybe because you don't know what's happening out there. So thank you for answering that question and for sharing that for those of us that don't know or didn't know how law enforcement get exposed and what that pathway is for us to work together in better ways. So I think you guys are a beautiful example of what's really working well. And I want to thank everyone for the contributions they have and for sharing that out across the state to all of our friends so that we can take some inspiration from what's working here and what's going well. I think we're going to switch over now to some audience questions. So Margaret, thank you so much for being here.
Thank you.
And again, for those of you who have questions for Margaret specifically on the public health side, we will make sure to get those to her and to follow up in writing with you. Okay, yeah, so what do we have?
First off, I know we have a couple people in the room who have mentioned that you yourselves are in long-term recovery. And thinking about, Greg, what you said at the beginning of like, we see all these stories and a lot of times we are led to this story that is just like, here's a sad statistic, do with it what you will. And for those of you in the room who are in long-term recovery, could you just maybe like tell us a little bit about the hope that you found on the other side of your addiction and what recovery has given you? Or as much as you're comfortable sharing, I should say that.
So I don't mind sharing. So I think that, you know, tipping the pain scale hit it spot on in the discussion of like the root of the emotional pain. And so what I've experienced and what I've seen in so many other individuals that are friends or that I've worked with in the recovery program that I'm involved in is how to deal with that emotional pain and what that actually looks like, you know. And so I think earlier, like Johnnie really kind of expressed the need for a support group and for support networking, whether that be family or friends or creating a new network. And I think the biggest shift in, you know, the truth of recovery for me personally is that it got worse before it got better. The first 2 years I was in recovery, I was not okay. And so I think going through such a raw and vulnerable period, having others and knowing that I'm not alone was just the key in being able to make it through that process.
Yeah, you know, I think Darren says it in the film, it's, you know, on the other side of the pain, you know, comes freedom. And, you know, that locked in active addiction, and, you know, you want to do all these things in your life, or I mean, I got into recovery really young and I got addicted really young. And so I'd sit around and, you know, talk about all these things that I was going to do in my life, and never, you know, woke up the next day and never did anything. And you know, and recovery's really been able to do that, and, you know, to make films like this, and to you know, work on policy issues like that was never in the cards for me. It was, you know, just following the journey and following the next right thing. And, you know, I think the biggest thing for me is that recovery's given me a willingness not to, you know, be scared to take risks, you know. And I was really scared to tell my recovery story publicly. Being 20, you know, 18, 19, 20 years old, I didn't really talk about my recovery story. I was really scared to talk about my recovery. And at one point I was talking to a mentor, and there was a news article, and I told my story without my last name. And she said, you know, well, what do I read in that newspaper article when you're sharing your recovery story? And I said, well, if I don't understand why you didn't share your last name. And I said, well, then I'm ashamed. And she said, is that why you're telling your recovery story in the newspaper? Because everybody else in the newspaper uses their last name. And so, like, those kinds of mentor moments and those teachable moments really hit hard, where if I was going to engage in community activities, or I was going to engage in these things, you know, if you don't have a lot of money in this country, the only political power you have is your story and in your community. And so anyways, I think it's really important for those of us who can in recovery to speak out for those who can't. So it's really given me an opportunity to do that.
I think, I'm not sure if I remember you mentioned, or if it was mentioned in the film, but trauma is a big issue as far as people becoming addicted to something, because the trauma, whether it's being bullied as a young child, or being sexually molested, any kind of trauma, and it sits up here. I don't like it. It feels bad. I want to do something to make it go away. So I find me a drug, or I find me some alcohol, or I find something that's going to help this up here not feel as bad as it is right now. And the unfortunate thing about it is that we become addicted. We like that little feeling it's giving me right now. So if I do 1, 3 is going to make it feel even better. How about 5? And before you know it, you're spiraling down. At least that's the way it was for me. I can't speak for anybody else. And being a Vietnam veteran, that put even more junk inside my head that I wanted to get rid of. And I used a lot of stuff to try to numb the pain from that. And I think that's what a lot of people do. They're trying to numb the pain inside their head, where there's a chemical imbalance from a mental health diagnosis or where there's from trauma that they've experienced in their lifetime, growing up in poverty, seeing gang violence. All this stuff traumatizes people. And they don't, it's just a very uncomfortable feeling in your head. And I did not decide on my own to get sober and clean. The Department of Corrections for the state of North Carolina is what got me clean. I went to prison, I got clean, and I discovered in there that there is a different way to live. And I'm thankful for that.
So are we. Thank y'all for sharing. I have kind of a long question, so just bear with me, and I'm happy to read any of it. But this person has quoted something, and I want to read that so that the whole question makes sense. So it says, New Hanover County is set to receive more than $18 million from an opioid settlement. The county statement says they will be utilizing these opioid settlement funds and the county's $50 million mental and behavioral health fund that was established from the sale of the hospital. The county will develop a comprehensive mental health and substance use disorder strategy that will ensure a sustained commitment to this issue over many years. And there's a little bit more, but the question is, what do you feel are the critical components in building that comprehensive mental health and substance use disorder strategy that would be sustainable in Wilmington? I know that was a lot, so if I need to repeat anything, let me know.
Establish some affordable housing. Housing in Wilmington is outrageous. And most of the people that we deal with, I work with, they're looking for affordable housing.
Yeah, and I think, I mean, it's amazing that the county has these resources coming in. And I think what's so important about building these sustainability plans is to really do it. You know, everyone's got these lists of all, you know, here's all the different kinds of treatment services, and here's all the social determinants of health, and here's this list, and you've got a list of 40 things, and it's like, okay, do we have one of those? Do we have one of those? But there's some quantitative analysis to do around this work to kind of really assess, like, you might be overbedded in residential, or you might not have enough slots in outpatient service, but really start to do a thorough gap analysis of what services that you have and what services you don't have as part of that. But in terms of the sustainability piece, I think, you know, without a value-based care reimbursement strategy, a population health reimbursement strategy, so these resources will run out, and that the services won't be sustainable. I think we'd all love 5 years, 10 years to say that we're not dealing with addiction and mental health issues, but that's just not the case. We need to build permanent infrastructure, just like we have with diabetes and heart disease, and, you know, really systematize it for sure, and prevention.
So I will just speak briefly to that, and because I heard two different parts with the question, overall question of you know, ultimately how will the monies be used. But when you talk about the opioid settlement funds, those monies are very specific. They're very specific to treating opioid use dependence. There are particular guidelines that need to be followed for those monies to be spent. So I think from that standpoint, it should be fairly simple in deciding how those monies should be spent. With the other monies that were mentioned from the sale of the hospital, again, you know, when you talk about strategy, so much of that work has been done. We know what the needs of the community are. And so we need to make sure that the resources go to those programs and those places that we know have a proven track history of being able to provide good services, access to care for those who need it. And if it's going to be distributed over time, making sure that that's done in a way that keeps those services sustainable.
Well, there's some specific costs that law enforcement bears. We're talking about naloxone, right?
Yeah.
And I've been in law enforcement for 36 years. For the first time in my career, police officers are carrying medicine, which they never did before, as a result of this epidemic. So that's a small thing, right? That's a line item. But then there's the mental health care costs and problems that are kind of upstream from some of the things that we're seeing. We need bed space. We need dedicated folks that can engage with people who are having these problems, and we see them on the streets of our city, and they're underserved, you know, so we have those issues. I think earlier we were talking about detox. We had one very small facility here in our region, and that was ended. So we've got short-term and long-term needs.
And I'll add in there that what I hope is also included is a dedicated pathway for caring for, supporting, retaining our frontline workforce on the behavioral health side that are working in this right now. Johnny's mentioned peer support, that rate of pay going up a little bit. I think across the spectrum, we need to look at, do we have enough folks qualified to do this level of service that they're doing? Are they getting paid enough? Are we keeping them into the system, or are we losing them to places that they can make more money and it's less stressful and sort of, you know, hard, heavy work? And then how are we caring for those people who are doing that now to keep them healthy as well? So are we talking the talk in this for the people who are doing this work as well?
Responder fatigue.
Yeah, yes, absolutely.
Yeah.
Yes.
So this kind of ties into all of this. Sarah, you mentioned earlier that we're seeing more resources come in than we have previously. And how do we make sure, Margaret, like you said, that they go to the right places, like when it comes in, right? I think that the issue, the field has said for a long time, like, well, if we just had the funding, we could do a lot of things. And all of a sudden the funding's here or is coming and our hands are still a little bit tied. I don't know if that's exactly a question or just maybe something to noodle on together, but.
So I'm sure Margaret has different perspectives on this, or more localized perspectives, but I will say, reach out to your elected officials, your legislators. If you have not introduced yourself to your state rep or your state legislator or your state senator, do that. Let them know what is important to you. Let them know why it is important to you as a constituent in their area. Show up at city council meetings. That's where you have an opportunity to hear how they're interacting in this space. Introduce yourself to your county commissioner. Show up at those meetings and make your voice heard. That's the first step, I think. Well,
I just wanted to comment, when we hear that there are lots of resources coming to this area, I think, you know, we all just recently heard that $18 million is coming to New Hanover County as a result of the opioid settlement. What we also heard, though, is that $18 million is going to be spread out over 18 years. So you're talking about $1 million a year for 18 years. When you talk about services and providing those needed services that we have, it's not a lot. I'm not poo-hooing it, please understand that. But I think we need to be clear in understanding that we're not getting a pool of resources thrown at us as a result of that money coming in. So we need to understand, and when you talk about the workforce, providers are challenged right now with being able to keep individuals employed because they can go someplace else, perhaps for more money. They can work remotely, whereas some services require that you not work remotely. I had this conversation this morning, and that is to say, yes, we want to make sure we have qualified individuals to provide these services so we get it right. Coastal Horizons has a history of doing that. But we make sure that we know that they get the proper training that they need. And if we don't right now have licensed staff, but we have qualified professionals that can provide the service, then we need to provide the service, because otherwise we're not allowing those that need to access the care they need to receive it because we don't have the person to provide it.
Anyone else have thoughts on that one? How to interact and make sure that the money goes to the right space?
Well, and uniquely in this region, of course, we have over $1 billion of fund from the sale of the hospital. So the question is, who decides how that gets distributed? So if there's ever a time period where our citizen community wants to weigh in and make sure that's an equitable process, now's the time to make your voice heard to make sure that the money will go where it's needed.
Right.
Agreed.
Yeah. And I think what you said, Sarah, is it's spot on. I think, you know, Lauren says it in the film, you know, if you're not at the table, you're on the menu. And I think it's just, you know, whether you're.
Did that come from the Sopranos?
I think so. But yeah, as you know, that's what she did. She got involved and she now, you know, she now tells the healthcare authority in Washington from the legislative seat, no, those federal block grant dollars are our money, not your money to choose, you know, so that we're the state legislature and we'll tell you how to spend that money, right? And so, you know, I think in states like North Carolina and Washington, where you have lots of bipartisan politics that you need to work to get anything done, it's really, really important to be in the State House. And it's really, you know, on an issue that has one of the few things that is not entirely polarized, right? Like one of the few things that Congress can do, one of the few things split state houses can do is mental health and addiction stuff. You know, and it's one of the, you know, sad things in America right now, American politics, but there are things you can do, you know, from those seats, and those that are called, you know, need to go sit in those seats because we need people who care about this issue first and foremost, leading the charge.
So I would be remiss if I didn't also mention that there's a survey coming out to everyone who saw the film, interacted across the whole state. So please respond to that, because as the association that focuses exclusively on the continuum in the addiction space, it's our job to speak on behalf of people who can't or won't or are not comfortable and it's not their skill set. So it's our job to be the mouthpiece and voice for that. So please fill that out. I promise you that is how I shape what I'm advocating for. It's when I go down to the State House, it's how I say, here's what we need as a state, because it's not what I think, it's what we need as a state. So please fill that out and we will advocate for what we're hearing from you. Okay, what else do we have?
That is it for questions.
Okay, good.
Unless people listening, if you have any more, please get them in and we'll answer them. And if we don't answer them right this second, we will answer them by the end of these events.
Mm-hmm. Yeah. If additional questions come in, like I said, we'll be doing lots of follow-up from these events. You will see APNC, we've been recording all of these. You'll see a compilation of that. So we're creating a visual story across the state. You will see advocacy tools that are being used specifically based on what we hear in each area. So there'll be lots of follow-up and lots of our opportunities to engage with us. So please don't be strangers. Anyone can find my information on our website and all of our fabulous staff. So if you have additional questions about how can I get involved, what can I do, please don't hesitate to reach out and we can help you find the pathway that is going to work for you and that you're comfortable doing or have time to do. Is there any closing remarks that we have to add to the conversation before we end?
I actually do have a question for you. Since you've been having this conversation across the state, what have you noticed in terms of trends or differences in different areas?
Yeah. So what I have noticed is that each conversation feels really, really different based on what is going on in that area, which has been illuminating for me because to me, there are lots of problems everywhere and we're all experiencing to some degree the same kinds of issues. So in some areas we've heard a whole lot about harm reduction really having some real problems getting into the community or being accepted by the community. Lots of those issues in some areas, but not all. What I have heard is certainly wanting to be involved with policymakers to help them make sure that people who need help can get help right now, given all of the resources that we have available and all the skill sets we have at the table. The kind of fragmented nature that Greg alluded to how our system is put together is like a patchwork, and the need to really pull it together in a way now that we haven't had to before is really the common theme that is going through. The other one that I've heard really loud and clear is how challenging it is to deal with some of these things. So we've heard lots of stories. Some of them are really very personal. And so I appreciate everyone who has shared with us on these panels because it's not easy to just put it all out there. And when I think it's important for us to model that though, because in the space of you're a parent, maybe you work in the field, right? You're a parent and you should know exactly what to do. This is my child. I should know exactly what to do. When you don't know what to do, that's a hard thing. It's a hard thing to deal with, I think, in lots of ways. So substance use is, there is a lot of sort of self-stigma even involved with it. And I think as parents, we take a lot of that on ourselves. We should just know what to do. I should just know who to call. I should know what
did I do wrong?
What did I do wrong, right?
Yeah, sure.
Yeah, so we've heard, a lot of that and certainly the sentiment is really that it's not just a small group anymore who really need help. It's everybody needs help in some way or another. And so I appreciate that coming out of these conversations too.
I'll just, encourage folks watching or listening to this that please share, if you enjoyed the film, please share it with your friends and colleagues in other states. And you can visit tippingthepain-scale.com. And thank you to APNC for bringing this film to your community. We'd love to do this in other states to be able to have these conversations and be a platform. And knock on wood, we'll be having some in person very soon with community gatherings. So there's nothing like getting people to the table and convening community conversations, using a film or using a tool like this. So really grateful to folks who are willing and able to share this project.
Yeah.
I would just jump in and say to folks who are watching from APNC that there's a lot of partnerships that are out there that you can either leverage or start your own. So I encourage you to reach out to your local law enforcement agency, sheriff's department. And if you have concerns that law enforcement maybe needs to do more, they probably want to do more and just don't know that yet. So find the chief, find the sheriff, find the appropriate person and give them an opportunity to help you deal with these issues.
Mm-hmm. Yeah. Well, thank you to everyone who has joined. You will be getting lots of follow-up from us. Please don't be shy. Please fill out the survey. I promise you that all your questions will be answered. And I also promise you that if you took the time to share with us what's important with you, we'll use that to speak on your behalf with our leaders across the state. So thank you for joining, and we will see you in 2 days in Charlotte for our next and final. So thank you everyone. Have a great night.